The bony opening for the nose is called the piriform aperture. Inside it there are two nasal cavities, a right and a left, separated in the midline by the nasal septum. To get a better look inside, we'll divide the skull in the frontal plane along this line. There's a lot to see here. Let's get ourselves oriented. Here's the hard palate. Here's the floor of the anterior cranial fossa. Here are the medial walls of the orbits. Here are the two nasal cavities. The septum dividing them is a little off-center, which is not unusual. The roof of each cavity, formed by the cribriform plate, is very narrow. The medial wall of each nasal cavity, formed by the septum, is smooth and featureless. So is the floor. By contrast, the lateral wall is marked by a number of features, most notably by these three delicate bony projections, the conchae, also known as the turbinate bones. This is the inferior concha, this is the middle concha, this is the much smaller superior concha. The three conchae partially divide the air passage into three parts: the inferior meatus, the middle meatus, and the superior meatus. Here's the back of the orbital cavity. Below it is the hollow space in the maxilla, the maxillary antrum, which we'll look at later. At about the level of the floor of the orbit, the nasal cavity becomes much narrower. The narrowing is caused by the presence of this collection of small hollow spaces, the ethmoid air cells. We'll see more of these in a minute. To see more of the septum and the nasal cavity, we'll look at it in a skull that's been divided just to the left of the midline. Here's the bony part of the nasal septum. It's formed by this part of the ethmoid bone, the perpendicular plate, and by this small bone that we haven't encountered up till now, the vomer. The lowest part of the septum is formed by the maxilla and by the palatine bone. Here's the divided left cribriform plate. This projection above it is something we've seen before. It's the crista galli. The frontal section we were looking at was divided here, just behind the crista galli. Now we'll remove the septum to get a good look at the lateral wall of the nasal cavity. The roof of the nasal cavity runs along this line, rising to its highest point along the length of the cribriform plate. Here are the conchae again, superior, middle, and inferior. There are several openings in the lateral wall of the nasal cavity. They're partly hidden by the conchae. We'll see them in a minute. The lateral wall of the nasal cavity is formed partly by the maxilla, partly by the ethmoid bone, and partly by the perpendicular part of the palatine bone. Here's the frontal sinus cavity. Here's the maxillary sinus cavity, seen through an artificial opening. The frontal and maxillary sinuses both open in this complex area beneath the middle concha, which we need to look at in more detail. In a dry skull, there are two large irregular openings from the nasal cavity into the maxillary sinus, separated by this flake of bone, the uncinate process. In the living body, all of this opening and much of this one are closed off by soft tissue. The real opening of the maxillary sinus is back here. If we look in from in front, we can see that the opening is quite high on the medial wall of the maxillary antrum. The frontal sinus opens into the nasal cavity by way of a narrow passage, the frontonasal duct. The frontonasal duct starts above the uncinate process and runs upward and forward to reach the frontal sinus. The frontal and maxillary sinuses open into the nasal cavity, not directly, but into a narrow side chamber located here, called the infundibulum. The infundibulum isn't apparent in a bony specimen. We'll see it when we look at the soft tissues. Now we look at the openings for the other sinuses. The sphenoid sinus opens into the nasal cavity here, above and behind the superior concha. The ethmoid air cells, which are up in this region, have several small openings into the nasal cavity. Some of these are behind the middle concha, some of them are below it. As we've seen, the bony passage for the nasolacrimal duct starts here. The nasolacrimal duct, which is quite short, passes downwards and backwards to open beneath the inferior concha. Here's its opening. The left side of the face. Here's the nasal septum. Before we look at it, let's get oriented. Here's the anterior cranial fossa. Here's the bony palate, or hard palate, with the soft palate extending behind it. Here's the oral cavity. Here's the opening of the right nasal cavity. Behind it is the nasopharynx, which we'll look at in a minute. The nasal septum extends from here behind to here in front. This small part of the septum is covered with skin. The rest of it is covered with this layer of mucous membrane. We'll remove a small piece of the mucous membrane so that we can appreciate its thickness. The highest part of the septum is the specialized olfactory area. It contains some of the fibers and nerve endings of the olfactory nerve, which are the sensory receptors for our sense of smell. The cribriform plate, which the olfactory nerve fibers go through, is at this level. Now we'll remove all the mucous membrane from the septum so that we can see the underlying cartilage and bone. This part of the septum is bone, as we've already seen. This part is formed by the septal cartilage. In this specimen, there's an unusual defect in the cartilage here. In front, the septal cartilage forms the bridge of the nose down to here, then runs downward and backward to attach to this bony prominence on the maxilla, the anterior nasal spine. Now we'll remove the whole of the nasal septum so that we can see the lateral wall and floor of the nasal cavity. The inside of the nostril, up to the lower border of the lateral cartilage, which is here, is called the nasal vestibule. It's lined with skin. The rest of the nasal cavity is lined with mucous membrane. Here are the conchae, superior, middle, and inferior. The mucous membrane that covers them is richly supplied with mucus glands and with blood vessels. The complex surfaces of the conchae have important functions in humidifying the inspired air and warming it. This olfactory area, like the corresponding area on the septum, contains olfactory nerve fibers and nerve endings. We'll remove the conchae. The inferior concha was here. Here beneath it is the opening for the nasolacrimal duct. Beneath the middle concha, which was here, is a deep groove called the semilunar hiatus. To see where this leads, we'll retract its lower border with this thread. The semilunar hiatus leads into a narrow, irregular side chamber called the infundibulum. The infundibulum receives the openings of the frontal sinus and the maxillary sinus. Sometimes the more anterior ethmoid air cells open into the infundibulum too. Sometimes, as in this case, they open separately, below the middle concha. Here's where the superior concha was. The more posterior ethmoid air cells open below the superior concha. The sphenoid sinus, which is this cavity, opens forwards into the highest part of the nasal cavity, the sphenoethmoidal recess. Here's the frontal sinus cavity in a different specimen. The opening to the frontonasal duct is behind here. Here's the maxillary sinus cavity, opened from in front. The opening from the sinus into the infundibulum is all the way up here on the medial wall. Here are the ethmoid air cells, with the lamina papyracea removed. This opening in the medial wall of the orbit also exposes the infundibulum. Each sinus has been removed. Here's the cavity for the right frontal sinus. There's a left one, too, on the other side of this partition. The frontal sinus extends upward behind the lower part of the forehead, and also, to a variable extent, backwards, between the roof of the orbit and the floor of the anterior cranial fossa. Here's the cavity for the right maxillary sinus, also known as the maxillary antrum. It extends backwards to the part of the maxilla that borders the pterygomaxillary fissure. It extends downwards almost to the root of the upper molar and premolar teeth. The medial wall of the maxillary sinus is also the lateral wall of the nasal cavity. Its roof forms a large part of the floor of the orbit. The sphenoid sinuses occupy the central part of the sphenoid bone. This opening has been made to show the right sphenoid sinus. To see it better, we'll look at the skull divided in the midline. Here's the right sphenoid sinus again. Above the sphenoid sinus is the floor of the anterior cranial fossa and the sella turcica. Behind it is the basilar part of the occipital bone. In front of it is the high part of the nasal cavity. Below it is the roof of the nasopharynx. Lastly, we'll come round to the front to look at the collection of small cavities that contain the ethmoid air cells, collectively referred to as the ethmoid sinus. These extend from just behind the nasolacrimal duct all the way back along the medial wall of the orbit. As we've seen already, the ethmoid air cells lie between the medial wall of the orbit and the lateral wall of the upper part of the nasal cavity. Here's the frontal sinus cavity. Here's the maxillary sinus cavity, seen through an artificial opening. The frontal and maxillary sinuses both open in this complex area beneath the middle concha, which we need to look at in more detail. In a dry skull, there are two large irregular openings from the nasal cavity into the maxillary sinus, separated by this flake of bone, the uncinate process. In the living body, all of this opening and much of this one are closed off by soft tissue. The real opening of the maxillary sinus is back here. If we look in from in front, we can see that the opening is quite high on the medial wall of the maxillary antrum. The frontal sinus opens into the nasal cavity by way of a narrow passage, the frontonasal duct. The frontonasal duct starts above the uncinate process and runs upward and forward to reach the frontal sinus. The frontal and maxillary sinuses open into the nasal cavity, not directly, but into a narrow side chamber located here, called the infundibulum. The infundibulum isn't apparent in a bony specimen. We'll see it when we look at the soft tissues. Now we'll look at the openings for the other sinuses. The sphenoid sinus opens into the nasal cavity here, above and behind the superior concha. The ethmoid air cells, which are up in this region, have several small openings into the nasal cavity. Some of these are behind the middle concha, some of them are below it. Look at a specimen that's been divided in the midline. The passage for air and the passage for food and liquid begin separately at the nose and the mouth. Air passes backward through the nasal cavity and the nasopharynx. Food and liquid pass backward through the oral cavity. The two passages unite here. Air, food and liquid all pass through this common passage, the oropharynx. The two passages separate again here, in the hypopharynx. Food and liquid pass backward into the esophagus on their way to the stomach. Air passes forward through the larynx and into the trachea on its way to the lungs. The thyroid cartilage hangs directly below the hyoid bone. The upper border of the thyroid cartilage has the same curvature as the arch of the hyoid bone. The thyroid cartilage is suspended from the hyoid bone by this membrane, the thyrohyoid membrane. On each side, the posterior part of the membrane is thickened, forming the lateral thyrohyoid ligament. The inferior horn of the thyroid cartilage articulates with the cricoid cartilage at the cricothyroid joint. Unlike the thyroid cartilage, which is open at the back, the cricoid cartilage forms a complete ring. Here's the thyroid cartilage. Here below it is the cricoid cartilage, hidden by the cricothyroid muscle. These two cartilages form the framework of the larynx. The thyroid cartilage is suspended from the hyoid bone, which is here, by the thyrohyoid membrane. Below, the cricoid cartilage is continuous with the upper end of the trachea. Here's the trachea, here's the esophagus, here's the lower part of the pharynx. To see the larynx from behind, we'll remove the posterior wall of the pharynx. Here's the opening of the larynx, the superior laryngeal aperture. It faces almost directly backwards. The opening is formed in front by the epiglottic cartilage, on each side by this fold of soft tissue, the aryepiglottic fold. To see the larynx from inside, we'll look at a specimen that's been divided in the midline. Here's the epiglottis, here's the aryepiglottic fold, here's the divided thyroid cartilage, and the divided arch and lamina of the cricoid cartilage. The important features of the wall of the larynx are this small side cavity, the vestibule, and these two folds in the mucous membrane, the vestibular fold above and the vocal fold below. Just beneath the mucosa of the vocal fold is an important structure, the vocal ligament, which we'll see shortly. Here's the larynx in the living body, seen from above with an endoscopic camera. Here's the epiglottis. Here's the left aryepiglottic fold. Here are the vestibular folds. Here are the vocal folds. Here between them, we're looking down through the vocal opening into the trachea. Here's the trachea by itself. Its upper end is continuous with the cricoid cartilage. It ends here, where it divides into the two main or principal bronchi. The principal bronchi begin to branch as they enter the lung, first into lobar, then segmental branches. The corrugated appearance of the trachea comes from the series of C-shaped cartilages that strengthen its wall and keep it open. In between them, the tracheal wall is soft, so that the trachea is highly flexible. Here, we've divided the trachea close to its bifurcation. The cartilages end here, making the trachea somewhat D-shaped in cross-section, with a posterior wall that's quite soft. Here are the lungs by themselves, seen from in front. They're being inflated with air so as to maintain their shape. Here's the trachea. Here are the two principal bronchi. This is the apex of each lung. This is the base. The space between the two lungs is occupied by the heart and great blood vessels. Each lung has three surfaces. The medial or mediastinal surface is marked by the hilum, where the bronchi and blood vessels enter. The concave inferior surface rests on the diaphragm. and the large convex costal surface faces the rib cage. Each lung is divided by deep fissures into lobes. The right lung has a superior lobe, a middle lobe, and an inferior lobe. The left lung has only a superior and an inferior lobe. Here are the lungs seen from behind. The fissures that separate the lobes extend all the way round onto the mediastinal surfaces. The space between the posterior parts of the lungs is occupied by the vertebral bodies. To see the lungs in a more intact setting, we'll look at a dissection in which the anterior chest wall has been removed. Again, the lungs are being inflated with air to keep them expanded. The surface of these lungs is discolored by trapped carbon particles that come from a lifetime's exposure to smoke. The two lungs are separated by the mediastinum, the midline partition that's occupied largely by the heart and great vessels, and also by fat and lymph nodes, and in childhood by the thymus gland. The surface of the lung is formed by the visceral pleura. The visceral pleura covers the lung completely, except here at the hilum, where it becomes continuous with the parietal pleura. Taking a close look at the edge of the lung, we can see the alveoli, the tiny air spaces where gas exchange occurs. They are opening progressively as we slowly inflate the lung. Here's the divided right pulmonary artery entering the hilum of the right lung. Here's the left pulmonary artery. A little below the pulmonary arteries on each side are the pulmonary veins. Here on the right, here on the left. Above and behind all the great vessels is the lower end of the trachea, or windpipe. It passes downward into the thorax, just to the right of the aortic arch.